Jim, I lost your bio. So we're going to have to do something differently tonight. Those of you who may get the Memphis magazine, the kind of publication we have in Memphis, there's a yearly issue called Top Docs. Top Docs. And what it is, it's a listing of about 100 or so physicians in Memphis who are top in their field. And it goes by categories: pediatricians, psychiatrists, family medicine physicians, etc. And in each issue, in addition to doing a list, they also provide a feature article on one or two very special people who have made a special commitment to healthcare in Tennessee, and in Memphis, excuse me. And I'm just going to read a few paragraphs from this particular issue of Top Docs. If you'd like to know how to make a better and healthier Memphis, look no further than Dr. James E. Bailey, a practicing internist, professor, and researcher for UT Health Science Center. Bailey's many titles fall under the umbrella of a conviction to save lives in ways both small and large. As a young medical student, Bailey was drawn to primary care by the idea of taking care of the whole patient, making people healthier through simple changes in their daily lives. He prefers practical applications, such as urging people to quit smoking, as opposed to extensive treatments and surgeries. He helped found the Healthy Memphis Common Table, a health and healthcare improvement collaborative that allows Memphians the opportunity to rate and compare physicians, get information on healthier living, browse community events geared towards healthcare. Bailey is also an advocate for coordination of care, a role that often falls upon the family practice doctor. Avoidable medical mistakes are still a leading cause of death in the United States, according to the National Academy of Sciences. The amount of time most people spend, considering the amount of time most people spend under medical care, that prospect is terrifying, especially to Bailey. He aims to consistently avoid such mistakes through quality improvement and health systems research. That's just a few paragraphs out of that extensive article. Now, we are very pleased to have the physician who was the subject of that article here with us tonight as the 2015 M.L. Seidman Town Hall Lecturer. Please join me in welcoming Dr. Jim Bailey.
Thank you, Michael. You're welcome. Well, thank you so much for having me here tonight. That sounds a little loud, is it? A little loud? That's better. I'm deeply honored to be in this place and at this school that has so much got it right for what our community needs in terms of building and encouraging the kind of healers that our community needs at this time. Focused on primary care with your PA program and your nursing programs here, as well as your many other great programs. It's so exciting to see part of the solution happening right here in Memphis to what I would say is our biggest social problem in America, healthcare. It's now 20% of our federal budget. 20%, we spend 20% of our GDP, of our gross domestic product, on healthcare. And increasingly, many people are worried we're not getting everything that we are paying for, are not getting what we should. So let me just begin by thanking Presidents Morelli, Dr. Ryan, Michael Ryan, and CBU and the Seidman Lectureship and the Knapp Foundation as well for having me here and giving me this opportunity. Tonight I'm going to talk about the end of healing. which is a really new and different venture for me, and I'm still, as you can probably tell, quite nervous talking about it. The End of Healing is a novel. I wasn't trained to write novels. I actually started in an MFA program after college to try and learn to write novels, and quickly discovered it'd be much easier to go to medical school. But somehow, 20 years later, I found myself writing a story. And tonight, I'd really like to talk a little bit about how that happened. I'm going to focus tonight particularly on chapter 31 of The End of Healing. It's near the end of the book, and it reveals some of the secrets of the book, I would say. It's called Industrial Giants Whose Time Has Passed. Now, for many of my colleagues in the insurance, pharmaceutical, diagnostic industry, medical device industry, this title makes a little nervous. You know, as part of the major medical monopoly, I guess the title of this chapter makes me a little nervous too. But we're going to delve into that a little bit. And rather than reading or giving too much of the story away tonight, I'm going to try and give you a little bit of a behind-the-scenes tour, or rather kind of an underground tour of The End of Healing, and through The End of Healing, where it came from, and a little bit of its secret code. So, let me start just by, let me start at the beginning. In 2000, early 2000, right at the very beginning of 2000, I had a vision, like many people did, of what our healthcare system could be like. And right at the beginning of the millennium in 2000, when I really kind of saw how things could work, how they might work, it was about 700 years, actually, to the day when one of my favorite authors, Dante Alighieri, had been elected to one of the six priors of his city of Florence, Italy. At that time, probably the greatest city in the world. And he similarly, 700 years before, of course I wasn't in any position of power, but had this idea that Florence, Italy, could be a new Jerusalem. It could be a place where people could live in justice and peace and work together for the good of all. And that heady time in early 2000 was a similar time for me. Several of my friends that were there then, that gathered together thinking about how we could reform our healthcare system, are actually here tonight. I'll let you discover them. But we had this vision that regional health improvement collaboratives could be a vehicle for people around the country to regain control of their own healthcare and their healthcare dollars. We knew then, back in early 2000, that resources were being wasted on things that didn't do anyone good, caused more harm than good. But nobody really was aware. And we thought if we can just wake people up and get them thinking about how healthcare could be, we could help transform the healthcare system and save lives. So we started like a lot of academics do, and what do? You come up with some principles, right? And these are the principles we came up with, the Memphis healthcare principles. And they're actually the principles on which Healthy Memphis Common Table, at that time it was known as the Justice and Healthcare Foundation, now it's known as the Common Table Health Alliance. These are the principles on which it was founded. In fact, we incorporated the Common Table in the first few months of 2000, focused on how we can bring people together to take ownership of their healthcare system and improve it so that they got what they needed and the care that they and their loved ones need most. And we felt that the core principle of all of these was that first one, that, and it sounds sort of obvious, doesn't it? That health ought to be the goal. the goal of everyone working in the healthcare system. That ought to be the goal. Not profit, not getting a good return for your shareholders, but health. And that if health was the goal, a lot of things were going to have to change. And we were confident that that's what Americans wanted. In fact, we found our principles were very similar to a number of sets of principles that various groups had come up with around the country. And we saw that regional health improvement collaboratives were emerging all around. And so it was a very heady time, full of great hope. But the sad thing was, our vision for transformation didn't happen. And it wasn't too far into 2000 that I myself began to lose hope and found myself in a dark place where, I knew that vision was great. Execution, implementation is very difficult. And we quickly saw that this task of mobilization of the public to demand something better wasn't going to be very easy. And around that time, the To Err is Human came out. How many of you have heard of this book, this report by the Institute of Medicine? So this was also in early 2000. And I had spent 15 years at that time, about 10 years at UT, 5 years before that, studying healthcare system design and quality improvement and how to make care better. And I knew things that quality of care in the U.S. wasn't as good as many people said it was, that we had some serious problems. But this report that the Institute of Medicine came out with opened my eyes to how bad things really were. To know that 4% of people in hospitals suffer a serious adverse event. That 1 in 5 tests, procedures, surgeries in the U.S. weren't necessary and did more harm than good. And that somewhere near 100,000 people a year are killed by medical errors. I heard that and I thought, that's unbelievable. That's impossible. And most of my colleagues really doubted this information as well when it first came out. But I went and I read the studies, doing what good researchers do, and I found out, gosh, if anything, this is a lowball estimate. These guys have been so conservative in how they've assessed errors and deaths related to serious errors in the hospitals. And you've noticed where all these errors occur, right? In the hospital, right? Where we put people in beds, we puncture their skin, sometimes we restrain them. It is a dangerous place. And most of my students, my medical students, knew that it was a dangerous place. But what we didn't know was that it was the place, our healthcare institutions, where you were most likely to experience an accidental death, to be killed by a mistake. My God, to think that healthcare could be the #1 place for accidental deaths. Now, I don't know if you've noticed, this is an old slide. Motor vehicle accidents are down to about 30 to 35,000 now per year, right? How do we do that? Seatbelts in. So this was really after seatbelts had gotten most of their gains. Airbags, an architectural systems-based reform. But we weren't seeing those kinds of reforms in healthcare at all. And the situation was far worse than the accidental deaths, 100,000 a year. That didn't take into account all the other adverse effects, the other harms that routine medical care causes. So some deaths in the hospital are due to mistakes, right? But the majority are due to known complications, right? We call those adverse effects. We don't call them mistakes. They're not negligent. Many mistakes aren't negligent. But when you total it all up, when you look at all the deaths due to health care, it ends up being closer, as my colleague Barbara Starfield showed, to about 250,000 deaths per year due to health care. How could that be? That this business that's supposed to be about healing harms so many? And how come no one knows? This was very distressing to me. And I saw in 2000 that most of my colleagues didn't want to talk about it, didn't want to accept it. They still have trouble, many of us. But I think what's happened since this time, there have been innumerable studies to show that this is the case. This is the way things are. And when you look across the world, in the last 10 years, it ends up being closer to 100 million people who have been killed over the last 10 years, maimed or seriously injured by healthcare, by routine mistakes that happen. And my dark place in in 2000 and in 2001 was made a little bit worse by this terrible event. You all know it, 9/11. And it didn't help that this was my birthday, that 9/11 was my birthday. And this mobilized the whole country immediately, these 3,000 deaths. And it was, though somehow made worse for me, that I knew in healthcare, a 747 load of people was being killed every day through mistakes that we could do something about, that we could fix. And yet, for year after year, 2001 after the IOM report, 2002, 2003, 2004, I kept thinking the change is coming, and it didn't come. Nobody took any real measures as a government, as a country, to really turn this really cavalcade of deaths and harms around. And so in many ways, it seemed to me worse than what happened at 9/11. Clearly, it's inadvertent. Everyone in healthcare pretty much wants to do the right thing, right? They want to heal. They want to help. Even insurance salesmen, I found. Pharmaceutical salesmen, they want to help. They don't want to do harm. And yet somehow they all feel incapable of turning the tide on the medical mistakes and the other problems in healthcare quality that we have in America. So the next thing that I think, should add to our distress, and at this point I'm just making you all anxious, but this is really the way I felt at this time. There's a lot of money involved. The average family of 4 in the United States now is spending nearly $25,000 a year, or having that money spent on their behalf, right? So it may be your employer's paying part of that money, but average, and this is data from the Milliman Index, so it's pretty well vetted. The average family of 4 is now spending nearly $25,000 a year. A lot of families of 4 don't make $25,000 a year. So the other thing is, for all this problem, we're spending a tremendous amount of money, and it's increasing leaps and bounds, and threatens to bankrupt us. So I think that's why I do agree with Mike that this is the number one social problem that we need to address in the United States in the next few years. So it ends up $25,000 a year per family of 4 for health care, about $50,000 a year per family of 2 for Medicare age people, and nearly 20% of our gross domestic product. We've got to turn this around, right? We've got to turn it around, and at the same time make things better. So As you could tell, I was in a real despair about, I was writing journal articles for the best journals I could get into, and I became convinced by about 2002, 2003, that writing more journal articles or sets of principles wasn't going to do it. We were also having a lot of trouble at that time with implementation with the Common Table Health Alliance, getting healthcare providers to work together and break down the silos to create systems that better coordinate care. It ends up as very hard, and we'll talk about some of the reasons why. But I became convinced around that time, 2002, that writing a gazillion journal articles wasn't going to do it. It wasn't going to awaken the minds and hearts of the American public, which was the group that really needed to know. And that what was needed was a story. That what we really needed was a story to guide us. And I knew at that time, I hadn't admitted that I was going to write a novel. If you'd asked me, I'd say that's a crazy idea. But I had this idea that there ought to be a story, and it needed to be a story of a young physician. And that young physician's journey into hell, really. The dark side of the healthcare industry. To show people what really goes on behind the curtain. And help them understand and put in context all the bizarre things that they hear about how to improve our healthcare system or how not to take action. So, and I thought that story ought to be a classic hero's tale of sorts. Like Theseus's journey into the labyrinth, to confront the Minotaur. Or Odysseus's or Aeneas's journey into hell. It ought to be that sort of a hero's quest journey. Hopefully with a little light at the end of the tunnel. And around that time, I thought, what's the greatest story of a journey into hell ever told? What do you think? Dante's Inferno. Well, I'd studied Dante's Inferno in college, and I started to think, could that be a good framework for a novel? Well, for a story. I wasn't admitting a novel at that point. It was going to be narrative nonfiction. And my wife kept telling me, "You're writing fiction, Jim, you're writing fiction." I said, "No, dear, it's narrative nonfiction." Because I'd already figured out I couldn't write fiction. But yes, Dante's Inferno. I thought, maybe that could be a model for my story. And this is actually 1472, original first printing of Dante's Inferno, the Divine Comedy. Printed in 1472, soon after the printing press was done. You probably know Dante was exiled. He was accused of graft and corruption and exiled from his homeland essentially a year after being elected to its highest office as prior. He was exiled never to return. I'm hoping for the things I say about the healthcare industry that won't happen to me. But his story starts out, "Nel mezzo del cammin di nostra vita, mi retrovai per una selva oscura, che la dritta via era smarrita." In the middle of the road of our life, I found myself in a dark wood where the straight way was lost. And of course, he decides he has to go down, right, with his guide Virgil, to see the varieties of human mistakes and understand them fully before he can rise to do good works and reach to heaven. And this is the beginning of that wonderful book. This is actually a picture of Dante with the 3 books that he wrote all in one, this Divine Comedy. His Inferno, his Purgatorio, and then going up into the realms of heaven. And this here is the city of Florence. And that's actually the cathedral there where this painting actually hangs in Florence, if you ever go to there. The largest masonry dome in the world. But depicting Dante and his 3 books. So what I realized, well, the first thing I wanted to tell you is through some really miraculous circumstances, and mainly through the good graces of my colleagues, my dean, Dean Herod, and my chairman, Dennis Schauberg, in the Department of Medicine, I had the opportunity to go on sabbatical. And without a clear plan, we ended up in Florence, Italy, where I was studying health system design, comparative health system performance, and history of medicine. And it ended up being a fortuitous place to learn also a little bit more about Dante and his great work. And what I discovered in Florence in revisiting Dante was not only was it a good framework, but it was a perfect ethical framework, moral framework for understanding modern healthcare. And what I'd like to do is give you a little overview of Dante's hell and what it looked like. He was a real theologian and thought very carefully of the arrangements in hell of the various levels, which, as you can imagine, get worse as you get closer to the bottom. And in the uppermost levels, he punished or witnessed the punishing of people who had made mistakes related to overindulgence or incontinence, as you can see up here. And he saw that as the least bad kind of sin. Overindulgence in food, drugs, sex, whatever. It's all here in all its glory. And Dante did write in rhyme, as you could probably tell. I decided early on that was probably a bad idea. In the second level, he has mistakes of violence. And in the whole bottom half, what he sees is the worst kind of sin that humans can make, and that's sins of fraud or deception, which he saw is a sin not of the passions but of the intellect, of the mind, purposeful, and therefore worse. And the worst kind of sin, of fraud of all, was treachery. To be a traitor to your friends, to your family, or worst of all, to your God, to your country. So this was his arrangement, and as I studied it, I found it worked incredibly well for healthcare. And then I discovered this set of illustrations, which probably most of you have never seen, by Botticelli. And people are probably know that Venus on the half-shell painting that's so beautiful. Well, he also did the first set of illustrations of the Divine Comedy. And this is actually his plan of Dante's Inferno. And as I studied these drawings of Botticelli and studied Dante, I saw how well that ethical framework worked to help us understand the problems we have to confront in the healthcare system. And this is what happens, actually, to my protagonist in the story. It ends up the protagonist, Dr. Don Newman, is the son of an Italian mother who grew up in her family's bookstore, where in the front window they have an antique illustrated edition of the Divine Comedy, which Dr. Don Newman inherits. And as a child, he learned the stories, and he studied the diagrams, with some fascination, because some of them are pretty wild. And it's after he leaves his residency and decides to follow this enigmatic, very iconoclastic professor named Gil Sampson, that he rediscovers this book and starts to see this connection between the problems that he's studying in his health system seminar and the levels of Dante's Inferno. And the parallels really begin to overwhelm him. This shows where Virgil and Dante, and I'm not sure if you can see this well, but are riding on this chimeric creature down into the depths of the area of fraud. And this creature has the face of a just man, but the body of a snake or a serpent. And he realizes that's just like the insurance salesman. That smile and tell us they're going to give us everything that we want, but often themselves even don't realize that a little more is going on with your money behind the scenes. Or a little farther down, where he encounters the bureaucrats, he sees, my goodness, we have such swindler bureaucrats in healthcare that here are being, at every level, the sinners are punished by the same punishment that they visited on others. So the bureaucrats who keep pressing us down into tar, in this case boiling tar, he saw were like the bureaucrats that continued. And for Don Newman, it wasn't just public bureaucrats, but private ones as well, which we've got many in our many industries, lots of rules and regulations, pressing that our modern bureaucrats weren't that unlike those of Dante's time. And similarly, in the level of the hypocrites, Don sees the Botticelli's drawings of the professors at the fancy medical school, walking in these gilded robes that look so beautiful in all their multicolors, but underneath are all lead. Dante says, in their gilded robes, all lead within. What a dreadful mantle to wear for all eternity. But Don sees, hey, these guys in lead robes, these are kind of like radiologists. But in truth, he sees himself in that time as a hypocrite who so often in his work put on the face of caring, while underneath he was hiding beneath a cloak of professionalism and not really connecting with his patients the way he needed to. Or a little deeper down in the level of the thieves who are afflicted by snakes, parasites, sucking their lifeblood. That was our sickness-focused healthcare industry, that sickness business, profiting from waiting until people get desperately ill and only then pulling out all the stops. Was that not somewhat like these thieves who were taking the last of people's lifeblood when they could be doing things in the front end? So Don discovers that this is a great analogy for healthcare in the story, as you'll see. And he encounters many of these industries and the stories and the people that work in them. Mostly people trying to do the right thing, but in a broken system. And what he discovers is that these errors of our broken system, which in our case are not purposeful, nobody wants to harm others, but that these errors do have consequences for patients and families and for our loved ones. And he discovers, in fact, that the priorities of the healthcare system are completely upside down. That where Americans spend the most money, they typically get the least care. And he begins to catalog in the back of his journal the money spent and where the most money is spent. And this is in $2,000. How many lives are saved in each sector of the healthcare industry? And how many lives are lost in each sector of the healthcare industry according, how many lives are lost through adverse events, medical errors, etc. And it doesn't take a brain surgeon to figure out that in primary prevention, primary care, paying for primary care first, doing simple things like checking blood pressure, we save hundreds, thousands of lives. But as soon as we wait until everything's gone wrong, we save far fewer and at much greater cost. So he sees that our system is really completely upside down. And where we think we're getting the most care, where there's fancy technology, X-rays, CT scans, is often where we're in truth getting the least, though at the greatest expense. And just to help you feel confident that this is not just Don's fantasy, this is an analysis by Reuters that they did just a few years ago, and at that time, they estimated that the waste in healthcare was not $4 billion. And in fact, that great study that was in the front page of the Commercial Appeal was only looking at the waste in breast cancer treatment and overdiagnosis and overtreatment. But the waste in healthcare amounts to about a third of our healthcare budget. $700 billion, according to Reuters and several other notable authors. Their latest estimate was over $800 billion. They don't see that we're making progress in reducing the waste. And you can see the categories that it's in. And this waste would be bad enough, except that all of this waste is also causing harm. So for all of this wasted expenditure, there's no benefit, right? There's no benefit on that side of the equation. So he realizes that we have a very serious problem. And he and his classmates, for that matter, despair about how to possibly invert this cone of death. And they wonder, why are our priorities upside down? Why are we, who would want that? Early on in their seminar, this seminar at an Ivy League school in the Northeast, a fictitious place, Dr. Sampson tells his students that if you want to understand why things are this way, why our priorities are upside down, you have to follow the money. He says you have to follow the money to understand it. And the students still ask him, but who would want this? Please help explain this to us. And Dr. Sampson generally is loath to ever give his own take. But when he's really pushed by his students to tell them what he thinks, in chapter 31, he actually decides, as many great teachers do, to tell them a parable, a story about why our healthcare is upside down. And he tells them that healthcare is like this room in this palace in Mantua, Italy, where he had visited. He went there because Mantua was the town of his namesake, Virgil, where Virgil had come from. And in this town, in the Palazzo Te, is this room that's strangely designed to be, in the 16th century, it was designed as a virtual reality. You walk into the room, and it's painted on all sides in a kind of a false reality depicting a war between the old gods, the Titans, the giants, and the new gods led by Jove. And Jove is hurling thunderbolts down on the giants who had been bold enough to try and overtake heaven. And so let me actually read a little bit of Dr. Sampson's description of this room, which he says is like American healthcare. The room of the giants, he says, is American healthcare today. Our major healthcare industries are giants reaching for ever greater power and control. These corporate titans have grown dumb, unaware of their own selfish motives, and forgetful of their original purpose. They collect gold, grow without bounds, and build impressive temples. Those entering their realm become disoriented and bewildered. They search for guidance and cannot find it. They feel small and helpless. They sense something is wrong. But the day of reckoning is at hand. Americans will not tolerate much longer the hoarding of resources by giant power-hungry industries that so obviously lack the ability or desire to promote health. The giants and their temples will fall. Not one stone will be left on another. All will be thrown down. The question is, will we all be destroyed along with the giants when it happens? The old era is passing and another age of better health care will come. The new order will see new gods, led by Jove, the force of nature, of evolution, the force in the world that abhors waste and lack of productivity. Modern treachery brings money and power, just as treachery of old brought 30 pieces of silver. Corporations are not inherently bad, but they defend their power and market share and seek to earn money for their shareholders, as they're compelled to do. In the hospital towers, there is plenty of money, but a large portion of it does not further health. Of course, those who profit handsomely in the current system will resist, but in refusing to change or curb their ambitions, they sow the seeds of their own destruction. Unfortunately, many good people, patients, will perish along with them. 4 giants dominate American healthcare today: insurance, pharmacy, diagnostics, and hospital. They are just dumb giants. But these 4 guard and support the greatest treacheries in healthcare. They are largely unaware of their betrayal when they put profit and power before healing. Like giants, they step all over the little people without realizing it. The giants prevent you from controlling your own health. They micromanage every medical decision. It's in their interest to maximize consumer spending and minimize costs, because their real goal is profit. Doctors are their front men. Advertisers, artists, and filmmakers depict their products as irresistible and necessary, and lawyers, lobbyists, and legislators create complex legal structures to protect their thrones with the force of law. So who's controlling the American healthcare system? Just these dumb giants. There's no brain behind it, no evil genius. Doctors, nurses, patients, pharmacists, administrators. Most individuals try to do the right thing, but we all ceded power to the trusted healthcare industries and allowed them to morph into selfish, corrupt giants. The giants developed systems to generate income and built towers to store wealth, and in the process they forgot their original healing purpose. The system is the problem. It evolved and now exists to create wealth and power, not health. So, that's a bizarre room, isn't it? This is where Samson leaves his students. And this is really where all of us live in our day-to-day life and work, underneath the crumbling towers of our broken system. And it wouldn't be so bad, but we see the harms that come from business as usual. In the End of Healing, Don, Francis, Bruce, and Dr. Sampson find these victims. People like Sybil Bellamy, a woman, a 57-year-old woman, productive, hardworking, who loses her insurance and ends up getting hundreds and thousands of dollars of hospital care, trying to prolong her life when she's had a massive stroke and has no hope for meaningful life and wants to be let go. A situation that a $5 a year hypertension medicine could have easily prevented. People like Mr. Jacobs, a 50-year-old man with premature coronary disease, who is encouraged to have risky surgery for his coronary disease, and ends up with a gaping wound in his chest and a gruesome prolonged death, when he could have been treated medically, probably much more effectively. People like Emily, the 18-year-old woman that Don meets with the long black hair, who gets a ventilator-associated pneumonia because the ICU director was unwilling to follow proven, standardized cookbook medicine approaches, like using what's called a ventilator bundle that would have ensured that she got the head of her bed lifted up and didn't get an aspiration pneumonia that left her a pulmonary cripple and shortened her life. People like Miss Pinkney, who, a 50-year-old college professor with metastatic breast cancer, that had her life cut short unnecessarily by experimental bone marrow transplant, by an experimental bone marrow transplant that had, at the time she got it, already been proven not to work. People like the 50 to 100,000 Americans each year that get their breastbones split open and ribs pried apart, who could be managed just as effectively, if not more effectively, by medical management. People like the 100,000 or more men and women a year, some with just indigestion, many with mild coronary disease, who have stents in the belief that these cardiac stents will save their lives, even though we know they never save lives, unless it's in the midst of a heart attack, right? They just help prevent chest pain. So the costs of business as usual are very high. And I think most of this evidence people need to know so we can see the way to make the change. The diagnosis is hard, and I'll be honest, this book is mostly about the dark side. It's mostly about the diagnosis of our problems in the American healthcare system. But as most of you know, you can't even begin to hope to achieve the cure unless you know what the disease is. So, what can we do? I have to say that The End of Healing at the end, in the final analysis, is an Easter story. It's a comedy with a happy ending. And I really do think there is hope for our healthcare system, and we'll close by just a little bit of talking about that. How we can find the true high-value healthcare that we all want and that we deserve. And the answer, just to give you a few clues, one idea that may guide us on our way to think about how we can flip the healthcare system and its priorities is a program by the Robert Wood Johnson Foundation called Flip the Clinic. And what the Robert Wood Johnson Foundation recognized is that most doctors and patients alike are bitterly unhappy with the 15-minute visit. And doctors and patients alike recognize that you can't do acute illness care, take care of acute complaints, preventive care, and chronic disease management for maybe 4 or 5 chronic illnesses, all in a 15-minute visit. It's impossible. So they came up with this idea of maybe we can flip the clinic to create opportunities to reorient how we practice. Well, one simple example of how we could make doctors and patients much happier by flipping the way we do things is look at the way we handle urgent care through the emergency room, right? The emergency room is the only place that people can get free care, right? It's the only place you can go anytime, day or night, and be sure that they'll take care of you. How crazy is that, to have the most expensive place be the easiest place to go to? And it's no surprise that ER doctors are the most dissatisfied in general, most burnout of physicians, because they know they can't do it in 15 minutes either. It means getting a head CT on everyone they see, right, that has a headache, which means lots of radiation and lots of harm with little benefit. Well, it ends up home visits are a lot cheaper than the emergency room. So an example of flipping the clinic would be, say, well, let's just pay the clinic to have a doctor that does evening rounds. It's much cheaper. The doctor has, or nurse practitioner, or even PA, has the patient's record and knows about your conditions before they even see you, unlike the emergency room. So those are the kinds of innovations that we have to be thinking about to invert this cone of death. And as we look at this, at one level, the answer is very simple, right? All you have to do is take this money down here, that now we know is up to over 800 billion, and move it up there, right? That should be very easy, don't you think? The only problem is every bit of that money is somebody's livelihood, if you could call it that, or somebody's profit. But that is the challenge that we're facing, is how to allocate in resources down here up to there. And so I don't want you to leave thinking that we're not without guidance of how to do that, because there is strong evidence on how we can flip the system and reestablish our priorities. And I'm not going to spend a lot of time on this, but this is the path that health care scientists around the world and the country have seen that we can follow to begin to reorient how we spend our health care dollars. And most of this stuff is hard to do. Most of it involves changing our business model. But the businesses that we need to be most successful, the new industries that can reorient and bring true high-value healthcare to people, are the ones that are going to be willing to let go of control in some areas and collaborate with other providers to, first off, do what sounds really simple, to do things like standardizing insurance, formularies, billing procedures, authorizations. Get rid of paperwork. Emphasize care coordination, primary care, and focus on building what we're now calling medical homes, places where we don't have just a harried doctor seeing people every 15 minutes, but where there's a nutritionist, a diabetes educator, a health coach, or 2 or 3 there to help be part of our team. So the byword of the future is going to be team-based care. And our providers often are going to be physician's assistants if we want true value in healthcare, because we don't have enough doctors going into primary care to begin to fill the need. And the money doesn't need to go to doctors' salaries in primary care. Most good doctors want to serve their patients, but what they do need is good infrastructure. And right now, primary care has the worst infrastructure to do the things that people need most. So these are a few of the strategies that I think we can begin to work on right now to invert the pyramid and change the way we do things, and begin to envision what our healthcare system would look like if it were properly oriented. Well, one of the first things I think you'd see in that vision is neighborhood clinics in every neighborhood. Not communities like Whitehaven, where we have more dialysis centers than we have primary care clinics, right? So every neighborhood ought to have a neighborhood clinic, preferably within walking distance. And no, those clinics don't all need to have fancy x-rays, right? Fewer hospital towers, perhaps, and more neighborhood clinics is at least part of the way. So we do know how to get there, and we know a lot of the solutions. So I don't want you to despair. And I want you to look for the companies, the industries that truly do put health first. And you'll find them in surprising places. Sometimes it's a for-profit healthcare company that's really the one that's decided that health for my customers is going to be my first goal. But I think that's what you should demand from all of the healthcare industries that serve you, is that they serve health and not profits first. The rest of the principles, I think, follow from there. So I want to leave you a little Dante at the beginning, a little bit at the end, with Rosie Greer's question to Richard Pryor when Richard Pryor was in his own dark place. He said, "Richard, what are you going to do?" And I think that's really the question for you, is what can you contribute to the coming healthcare change? How can you redevote yourself in your life to high-value healthcare? Healthcare that really brings the most and prevents need for rescue care in the hospital after it's too late. How can you help reorganize your healthcare system locally and help it focus on health first as the goal? We no longer have time nor money for worthless care. How can you, as a consumer, demand better care and be a true agent for healthcare change? Whether we find our way to something akin to the earthly paradise that Dante envisioned and eventually found his way to is up to you. Let me follow you, and thank you for your time and your attention.